The next presenter is Sheila McClelland. Sheila is the CEO of the Nursing and Midwifery Board of Ireland. This is the independent statutory organisation which regulates the nursing and midwifery profession in Ireland. Sheila has driven a reform agenda working with the board to agree and commence implementation of the 2020 to 2022 strategy, which includes a digitalisation programme. As part of the initiative, the registration of almost 80,000 nurses and midwives has been moved to a new digital platform. Registration. We welcome Sheila to speak about MYNMBI ICT system. Thank you, Sheila.
Okay, so thank you very much, Michael, for inviting me, and Edward, of course. So this has become a bit of an annual event, and I have been invited. Edward told me that I had to talk about digitisation, but towards the end I wanted to point and highlight a few more things that we're endeavouring to do. I tried to think about what would be interesting for directors in nursing and directors in midwifery when we have this opportunity. So can we just move on to the next slide, because I think that Michael has very eloquently sort of articulated the general gist of what's going to happen. So I mean, the agenda for what I'm going to cover today is, as you can see here, what we do. I'll take you through the different functions and the context in which we've been operating, and where we want to get to by way of contributing at a local and of course at a global level in a way that we haven't been able to do before accurately. What we have done and what our vehicles to get us there, I suppose, is a good way to put it. So we want to talk about the digitisation programme and how that will allow us to get leverage the data to be able to contribute at that international level and inform at a local level. And just the journey that we're on, what we've achieved and what we're going to hopefully do in the future, and where we would like your contribution. So could I have the next slide? So this is obviously a sort of maybe a standard slide that you'll have seen before from us and in our publications. It shows the direction of travel in relation to the most recent people have been put on the register. And applicants, you can see that there is a very clear trajectory towards you know, the ratio there of the non-EUs against the rest. I mean, the 13, 21, 91, 42 and 97 are the students that come out each year. You know, I would make the point that there's 1830 goes in and 1397 come out. So we lose a few en route, and we're going to do a bit of work in that. But overall, you can see that significant increase in 2019 for the non-EUs. And that will continue. We had significant interest whilst the COVID-19 crisis was at its height in relation to overseas applications. And I'll talk a bit more about those, because as you probably all know, getting those registrants on and the level of scrutiny we do is much different to localized or people that have freedom of movement within the EU. So you know, I think it's an important slide to take into account, but you know, and it is does directly talk to the policy position we have in relation to the number we're feeding through from the sort of the higher options and the education system we have in Ireland. So next slide, thank you. Yes, this is a slide just outlining the other areas that we of course get involved in. So not just do we maintain the register, but very importantly, we set the requirements for education programs in the higher level institutions. We operate with 13 of them are providing undergraduate courses and courses leading to registration in postgraduate circumstances. We also develop standards and guidance, and Edward mentioned about the code, and I know that my colleague Anne-Marie was delighted with that. I got a text from her immediately. So, I mean, thank you for that, and thank you for, you know, really baselining the whole efficacy of the nursing and midwifery profession in that, because we hold it very dear. I think we're going to be able to do more in producing standards and guidance in the future. But we know that is definitely one of our statutory functions. And very importantly, and the bit that nobody wants to talk about, but everybody talks about, is the investigation of complaints and the fitness to practice responsibility we have. It's very important, but it's not everything we do, and I'll talk about it towards the end. So moving on just to the next slide, just to show, you know, to just give a diagrammatical impression of where we sit. So you can see all the different sort of circles, concentric circles there. So we feed in at a sort of a nucleus of the system. I mean, Rachel spoke about where we're going and what we need to do, but regulation sort of sets the standards. I remember talking last year about being the skeleton or around which everything else hangs. And we will inform and affect and hopefully support the requirements, the policy changes that are coming with Sláintecare, with Brexit, and with just the change in demographics, and then be able, as I say, to contribute, at least be informed about how we sit globally, which is important for us. Okay, so the next slide, thank you. So then to move on to talk about the MYNMBI system. So we're very proud of this. We have managed to deliver this system and continue with sort of, without being thrown off course too much, in the whole COVID crisis. The staff here transferred, a lot of them, to working at home, but really continued to test this system to get it to the position where we went live on the 28th of September. We've been around for 100 years, but this is the most progressive platform for any regulator in Ireland. And obviously we have the biggest number of registrants of all the regulators. So we have about 80,000 registrants at the minute, but that amounts to 100,000 records. Those were all transferred, and you can see the different features of it. There's going to be a single log on, and I'll show you some of the screens in a second. There'll be paper-free document management and obviously enhanced reporting and data management. And, hopefully we will provide a much more efficient and transparent application process. At a localised level, again, I'll talk about it in a second, but the candidates have a process of getting themselves registered. It's more for the first-time applicants from outside of Ireland and from the non-EU areas. That can cause a degree of delay and more constraints and barriers. So can I just go on to the next slide? So in this slide, that gives you some idea of where we are. The applicants that will apply from now, from go live, I have to stress, will do the whole process online. So overseas applicants that we call in flight, that has commenced their process, they will continue on to a point when they get recognised with their qualifications, and once they have done their aptitude test or their adaptation, they then will transfer onto a digitised process, but that's towards the end, if anybody's aware of how this works. But from the commencement now, so anybody applying from overseas now will be doing it purely on a digital format. And the big change there for them will be that they won't pay anything until they have all of their documents lined up and can upload them. So by the time we start the process, we'll have everything we need, which is one of the big delays that we face at the minute. Registrants will pay their retention fees on this system and update personal information. The big change here will be, and we've consulted widely, and this is going to be an employment details screen for people to record their place of employment and the type of employment they have. So this is key. This field, this page, this screen, which will be presented before people pay their ARF annually, will allow for us to collect the details of who's clinical facing and the percentage of the population of nurses and midwives on the register who are clinically facing and otherwise. So this begins to feed into this bigger macro data set. Employers will be able to check the register, so you as directors will be able to check the register very easily and in real time about who is live and who's not. And it'll obviously then, as I say, at a macro level, it'll be hugely beneficial from a workforce planning perspective, and Rachel touched on that in her presentation. So the benefits we hope will be realised in processing time. So the graduates applicants this year, and we have I have here, we have applicants, the candidates that are on today, that we've had about 1,200 candidates who have now transferred to be in registrants, and they were processed in circa 3 days. The overseas applicants have explained to you we should be eating into the processing time for those significantly by the fact that we expect them to have all the data and the evidence before the process commences. Just to give you some idea, there are 79,000 registered nurses or midwives on the system at the minute. We have 5,998 live applications. A lot of those will be pre 28th of September, but a number of them will be from that. We transferred 8,057 candidates, and at the minute we have 6,985 candidates live on the register. So the reason that is the stat is because some of those people have now moved into the live registration, and others, some of the new candidates wouldn't have been formally registered yet. Okay, you can have the next slide. Thank you. This is just some images of some of the documentation and the guides that are available on our website now. And by the time we go to allow people to make their first payment in the ARF cycle in December, we will probably have pop-up videos, etc., available as well to assist people. But hopefully these guides, we've put hours into these guides to make sure that they are user-friendly. Could I have the next screen, please? These are just giving you some of the screenshots that you're likely to see. So you can see that when you log in, and you can see we have it in red, you don't need to create an account. You're going to get a mail shot from the NMBI, which will give you guidance about how you initiate your identification with the system. So you do that, follow the steps, and please do that, and please tell people to do that in the wider circles, because this has caused a wee bit of problems with candidates so far. But if you follow the instructions, once you have identified yourself for the first time, that becomes your personal login details. Once you get into the system, there'll be these drop-down boxes on the right or left hand side of the screen, and you can see from this you'll have much more, you'll be able to track through your own record. And you can request CCPS, you can see all the different functionality that's there. Okay. The next one, next screen, thank you. This one again is just to highlight that, documents that are lost or that you have misplaced can be replaced as the registrant. Okay, and the next screen is again for you as directors of nursing. Just the next screen. Yeah, so you'll be able to look up, as I mentioned earlier, you'll be able to check out registrants in real time. So the minute that it's updated, you'll see it. There's no batch running in the evenings. You'll be immediately able to see that that person is a live registrant. Okay, and the next screen, thank you. And this screen is a sort of behind the scenes screen in here. So it's to give you a sense of confidence that I've written down here, and I got it from my colleague this morning. 852,273 notes were transferred across into this new system. So when if people have problems and they need to speak to the help desk, which will be manned up with extensively more resources than would have been the case in the past, but if people need to talk to the help desk will have access to all these notes. So again, this is maybe more applicable for people that are in the process of applying, but this information has been brought across from the old system, so nothing has been lost. And I mean, if you can just appreciate the job that was, making sure that those records all landed in the right boxes. But we've checked them out, and we're completely sure they have. So the next screen then is about the data. So it is just to reinforce the point that from the Department of Health's perspective, at a national level, we will be able to contribute to the European Commission's requirements and, very importantly, the OECD requirements in relation to data and the statistics, and it'll be accurate. At the minute, some of it is skewed. We're coming up with figures like that we have things like we have about 4.6 nurses for every doctor. We know that's not right. The OECD average is 2.7. We know we're much closer to that. So this information will be able to show that we are not disproportionately well endowed with nurses and midwives in the system. It's actually to prove that, that more maybe investment is required, and it'll be quite nuanced. We can run it right down. Obviously, I'm stating that with GDPR constraints, we obviously will get to small data sets. At that point, we would have to question how much further we can go. But I know that the ONMSD, probably, and the union, and certainly the Department of Health are after us for these stats, and we have to come up with a model by the methodology by which we produce them. And whatever we do, they'll be in the public domain. Whatever we produce for one group is likely to be completely in the public domain and be used as big data for in the wider context. So from a research perspective, it's also good news. Moving on then to the next screen, thank you. So I want to talk then for a second about the other bits of digitisation. We're on a journey, so we want to digitise both as well as the register, which is obviously the biggest issue and probably the most complex. We also want to digitise the education side of the house to help out with site visits, annual reporting, and generally applications for either accreditation or re-accreditation of programmes. So I know that some of you want to be directly involved in this, but I just wanted to highlight some of the changes. So we actually have a consultation out at the minute on this, and I would really urge you all to think about being able to contribute to that consultation. The big changes here are going to be that, and this is brought about on a legislative basis. It's nothing to do with the digital system, but obviously developing a digital system has to reflect the requirements in the legislation. So we will be producing site inspection reports from HEIs, which of course directly impact on you as directors of nursing with the healthcare partners, and annual reports. So at this moment in time, we haven't completely pinned down what we're going to produce. We have a requirement to produce something. We obviously need to think about the public interest, patient safety, all these things. But I know that, you know, when you think this through, there's a live interest in this for you. So please go and have a look at our consultation. Part of the consultation is to look at the standards and requirements. We're going to reduce nurses' standards and requirements, the footprint, from about 144. Some of those directly impact on the HEIs, but many of them, as you know, are things that you, as the healthcare partner side, the clinical sites, have to answer. So that's becoming more streamlined, back down to about 73. Now, it's not really changing the footprint, it's just asking the questions in a more compressed way. So hopefully that'll make it easier. I want to walk you through for a second what will happen. So whenever site inspection teams come, they'll have probably handheld devices. So it won't be the old fashioned sort of trotting around the hospital with, you know, with a clipboard. So information will be gathered in sort of real time, and we would hope to let you have access to that so that you can challenge it in real time. So the process of inspection will become much quicker. And in fact, Anne-Marie is trying to undertake a virtual site visit now towards the end of this year. And in the spring of next year, we'll be doing another probably virtual site visit, but by that stage, we hope to have the digital solution in place. So you'll get the information, it'll be captured quicker, it'll be available to you quicker, and you can challenge it. So we're trying to make it open and transparent, but I do think that when people think through the ramifications of site inspection reports been published in the public domain on our website, you know, I don't want anybody to be surprised by that, and I want you to have your moment to contribute to that conversation. So please do go on and have a look at the consultation at this stage. And then just can I have the next slide, thank you. So I just want to talk then for a second about, because one of our strands in our statement of strategy is evolving regulation. And I think in the last few months, because of COVID, we have been required to be more agile with our regulatory standards, especially for the students. So we've made two substantial changes, one of which was made in the springtime, where we were able to agree with the HSE and the Department of Health that we would recognise up to 6 weeks placement as healthcare assistants for some of the students that were finishing those years and had disruption in their clinical placements. That will continue. The displacement obviously issue is not wholly over. We're doing our absolute best to keep students in situ, and I know that you're all working really hard to do that, and thank you for that, but please continue in that vein. But we are trying to be more accommodating, if you like, and as Rachel mentioned, we're looking at outcomes-based regulation in relation to how these students are facilitated through this year and into the next spring of next year, in the hope that no student becomes disrupted because of COVID in their capacity to progress, because we are looking at the big picture about having those 1,400 students coming out the far side each year and not being disrupted because of something that really wasn't by any means their fault. So again, there's a letter on its way to you as we speak, which is outlining changes that we are willing to, if you like, recognise in relation to the whole system of placements and being more like organic in how we can place the students in what we recognise as being appropriate. And back to Loretta's point, we're very focused and very enthusiastic about e-health and looking at the different solutions that might come about there and how people can maybe be involved in learning, but not physically in the same room as patients. So please, again, read that and contribute. You're well represented by Eileen Whelan in a forum that we run, but I'm sure Eileen would be willing to take, and the ONMSD obviously are involved in that too. So please feed back if you don't think that some of these are workable, or if you think you have other solutions, because none of us have the, the monopoly on having the good ideas. We need it fed in from all over. Can I have the next slide, please? Now moving on to fitness to practice, the subject you all love. So I know many of you, have had the requirement at times maybe to refer people to the board under fitness to practice, and then Edward steps in. So we're all sort of involved in this from various angles. But I mean, there is a requirement under the legislation for us to have the fitness to practice facility and have the capacity to hear and progress complaints. But we have a new bit of legislation that was only signed into law on the 14th of October. And it's a big piece of legislation. It amends many of the existing professional regulation bills and legislation that's in force at the minute. So it does have some substantial changes for the NMBI, and it hits across a number of areas, but much more concentrated in the area of fitness to practice. So I'll just run through some of the key points of that I think may be of interest to you. So we'll have the capacity now as the board to initially screen complaints to see whether or not they go to an inquiry, or is there a quicker route. We can eliminate frivolous or vexatious complaints. Now, I suspect that none of you people would be suggesting that anything you'd be raising is frivolous or vexatious, but we obviously look at a wider set of complaints, and sometimes we do find these, but at the minute we have no mechanism to extrapolate those out of the system, and they can obviously cause like great concern and stress to people as they're progressed if you're the person that's been complained against. We can at the screening stage deal with the registrant by consenting to be censured or undertakings which we haven't been able to really use to the maximum effect, and I know that Edward's very keen on this. Well, there's also the facility which we didn't have in the past for a registrant to agree to voluntarily come off the register. And there will be a change, which is quite a big deal, that we're going to reduce the number of people on the panels from 5 to 3. Now, maybe from an outside perspective, that isn't very obvious or radical, but actually for us scheduling, it is a big deal. Now, one of those members still has to be a nurse or a midwife, so you'll still have the professional representation, but it will mean hopefully that we can schedule cases much quicker and get them through. To support that, we'll also be bringing in digital support solutions. We're on the way to doing that as well. It'll be document management. It'll be talking to the law firms in a more transparent way, and maybe better management of the documentation for all parties, and obviously and scheduling software, which again should really help with the ability to maybe expedite cases quicker. So what next then for us? So just to sort of tie up with the next screen there, please, just yeah, so just to sort of what's coming next. So this is our 5 themes in our statement of strategy. So we've talked about how we've evolved the model of regulation in this year, brought about in a way that none of us could have foreseen at the start of the year. The digitisation process is underway. We will leverage the data set when we get it in March. And as I say, there is debate about what will that data set look like, but we have some requirements statutorily, then others will be for the stakeholders to contribute to that debate. And we'll be doing that through communicating better with you all, and, in a more open and transparent way, I suppose, well, as I said to Eddie, he can ask for stuff and I can justify why I say no, but I mean, it will be an honest conversation, if you like. And then we are on the journey to, I suppose, populating the organisation internally in a way that we can see these things through. So, we hope that at the end there'll be, that we will see more fluid guidance. And Rachel did mention that also we have other things we still have to do, like annotation and credentialing. things that are quite complex, because it's where you begin and end that process, and everybody has different perspectives on it, but that again will take big conversations. And a very important other element, which eventually will be captured on the digital solution, but is more about hearts and minds, is the maintenance of professional competence and bringing that forward. And there's a conversation started about that. So some of you will be involved and asked to contribute to the overall conversation about how we can progress and introduce that in a safe way. So just very finally, my final slide here is, I suppose I said last year where we'll be in 10 years. So I hope that these things still stand. I hope that we're on the journey to that. And I just want to finally take this opportunity to the directors of nursing to say that 2 of my colleagues who've been here for many years are going to be retiring in the next few weeks and months. So Ursula is leaving from the Director of Regulation, and I think Edward is aware of that. And Anne-Marie Ryan, who has served us brilliantly as the lead in education and professional standards and training, will also return in the springtime. So, you know, I think it's really nice that I get the opportunity to wish them a long and happy retirement. But we have a new top team been appointed, and the details of those will be getting circulated shortly. We haven't got anybody for Anne-Marie yet, but you know, Ursula's replacement is just about moving in behind her to pick up all the information. So thank you very much for taking the time to hear what we have and where we're going. And if you've got any questions, I'd be happy to take them.
Sheila, thanks very much for your presentation. Really appreciate it. The idea of "in God we trust, for everyone else needs data," I think comes to mind. And as well as nurses, we need to be at the forefront of that. So thanks very much for your presentation. Really appreciate it.